Hello, good evening, my beautiful people. Good evening. Hello, everybody. How are you doing? I'm just about to share this. I'm not going to take much of your time. Welcome to the Power Hour. I'm just trying to share this from my page. Hope everybody's doing well and you're having a beautiful evening, a wonderful day, week, month, wherever you are, whatever you're doing. I hope you are having a blessed one. So I'm just sharing the onto my main Facebook. We have a very exciting show today. This is right up my alley because this is a topic that I'm truly passionate about. Because we're talking about health, and you all know me. I'm a professional patient. Let's just put it like that. And yeah, I know I have not I haven't we haven't had that Power Hour episode for some time because of my part-time job as a professional patient. So I've been unwell, and yeah, the past couple of weeks has been really something else with my health. So give me a minute, I'm just sharing this so we can have more people here. I think I gotta zoom right this, and I have a special guest that we're going to be having very soon come up and see his take on this topic. All right, that's been shared on my profile now. Is yeah, so should see hopefully people coming and showing people now. So how's everybody doing? Please, if you can see this, can you kindly help and share the stream, please? That is all I need from you. I'm not going to ask you for money, but it would definitely help if you can share this. And yeah, so that is on my page now, please. Oh, let me make sure it's on my page actually because I'm still not seeing anyone yet. I'm just checking that it's on. How's everyone doing? All right, so Rajesh. All right, so that's has been shared. Yeah, so if anybody else sees this, can you kindly share the link? Let me go to my charts. Okay, check on my guest. And another thing that we have today, another exciting thing that we're doing today, we're actually going to have you, members of the public, viewers or the audience, we will be having you come on to give your own view on the topic. Yeah, so I'll be doing that today. You don't have to come. It doesn't have to be video. It can just be audio. You can just say your point of view. I will share the link at the time when we are ready. After my guest and I have really after our interview, then we'll let you come in and give in your own take on the topic. So let me just do that. All right, I'm just trying to all right, check that it's been shared so we can get straight onto this very, very, very important topic. I'm not seeing anyone yet, so I just want to refresh and check that it has been shared. Where's everyone? Knock knock. Oh, It's now they decide to send a message to say I'm live. Oh, Facebook, oh, Facebook, oh, Facebook. Is it now that you're sending a message to tell people I'm live? I've been here for 4 minutes. But I guess people are used to, actually, I think I came early there. People are used to BMT. They forget that we are actually operating on GMT. So, but I won't blame you for coming, a bit late, but we're here now. So let's just get on. There is somebody here now is showing. So good evening. I'm just going to wait to see more people. Share the link. Share the link. Good evening. Share the link and join the conversation. And I'm going to again introduce the topic because I know it's not that we're having some people come on, because everybody, even Facebook is late to send a notification. Oh Lord, oh Lord. See, this is not the problem. This is my thing. I operate as a business person, so I'm always on time. In fact, I'm always ahead of time. Being the first one to go. In fact, usually when I go to an occasion or party, I'll be most of the time I have to help them set up the place because I'll be there and they're just setting the seats. So the number of times I've been at parties and I've had to go and help them put together the seating arrangements because I'm that early. So, but we're here and I've missed coming on. So if I'm a bit rusty today, I have been away the past. I wasn't away. Like, when people say I was away, like they went on holiday. No, I was just away in the hospital, but I'm here. That's all that matters. I'm feeling much better and I'm just glad to come back. Sometimes it is such a struggle, we don't even realize, but I'm always very grateful for the strength and for God and everybody. So today we are going to be discussing a topic that is so close to my heart, and that is health, specifically the healthcare system, in Africa, most especially Sierra Leone, because that is where I'm from. I can only talk about what I know, and I know Africa is also very different. When you say Africa, you're talking about the difference between like South Africa and West Africa is like, day and night. So I am very much aware of that. That's why I say most especially Sierra Leone, because that is where I was born. I lived for the first 12 years of my life. So that is, and also that's where I have experienced healthcare. I have not been to any of our African countries or spent time, except for the time that the plane had to basically land in Monrovia and wait there because I decided to have a crisis on board. So that is as far as my traveling in Africa. Oh yeah, and then I got sick in Morocco. So my own traveling has always been within the terminal in airports in Africa. But when it comes to Sierra Leone, I know about the system. I go there, I use the healthcare system. And truthfully, I am passionate about health and well-being. I value health because I have gone through, a lot of health struggles in my life. So I know the importance of healthcare and having those basic needs and how important it is, But there is so much that we need to do, So if this is the first time you're watching and you don't know who I am, first of all, my name is Miriam K. You can find that here, and every other place. So in case you forget, my name is Miriam K. You can find that there. Ding, ding. Here. Ding, ding. On on the bar scrolling. Ding ding. So you don't forget the name is there. Yeah, but jokes aside, I am a sickle cell sufferer, but my own diagnosis did not happen immediately at birth. I was not properly diagnosed. I did start getting sick. My first crisis was at the age of 6 years old, but I did not actually started getting. I wasn't actually properly formally diagnosed until when I was 12 years of age when I came over to the UK. That was when I was diagnosed. And the crazy thing is, while I was growing up in Sierra Leone, there were all the stigmas about, having sickle cell. And I always vividly remember one of my memories, people saying it was witchcraft, I needed to confess, and all of these things, instead of just seeing that I was a child that needed support. Not my family, thankfully, this is just nosy Congosa neighbor. Yeah, saying all these things, and they don't realize the impact that had on me. But the crazy thing is, what really made me so interested in what we're discussing and the healthcare system itself, right? And Sierra Leone specifically, was after I was in England for some years. When I was back in 2018, when I was around 18 years of age, we went back home, right? That was the first time going back home since I came to the UK. And I was thinking at this time that there would have been a lot of changes because it had been years. So I was expecting that things were different for those that are going through, what I was going through. I was not expecting to go after all those years and realize that really nothing had changed. The healthcare system was pretty much the same. The way people were treated was pretty much the same. The stigmas, the labeling, all of that was pretty much the same. All those things were the same. And I was so frustrated, like, wow. I was not thinking that the generation would be going through the same difficulties and the same issues, and while I was there, I always have my own private doctor there who I call as soon as I arrive. Your favorite patient is here, ding ding, you know. But I always have my own private doctor. But then when I went in 2011, this time I didn't go 10 or 11, 11. I didn't go with my mom. No, 2010, I think. I did not go with my mom. That was my first trip by myself, without my family anyway. We were friends, but without my family. And I was like, I'm a big girl, I'm going traveling home by myself. And I went. And then I ended up getting sick while I was in Freetown. And my own private doctor is in Lunge. So now I had no other way but to end up going to the hospital. And what happened was, I was staying in East where my auntie was. We wanted to go to a hospital, a good private hospital that was in the West End, right? Because everybody was saying, no, 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 this hospitals. And I went to this hospital that's in East. Oh my God, I think the name is Roulette. Roulette. I need to think about the name. I think it was called Roulette. Sarola, something like that. I think so. That's the name. It's in East End. So because of the traffic, there was no way we were going to be able to make it all the way to West to go to a private hospital. And I, at this time, was having a really bad crisis. So we ended up having to go to this hospital, Sarola or Sarola, which was in East End. And I remember the minute we entered, first of all, they said we needed to register, which we had to pay for a registration card, right? And then we were sitting there and waiting and waiting and waiting and waiting. And at one point, I had turned to the people that I went with, who were also from the UK, I had turned to them. I was just there, like, there was this other child, a young child, a girl that was also there for sickle cell. So the parents were there to take her in for sickle cell, right? And I was there for sickle cell as well. So we were there waiting, at one point I turned and I was like, oh my God, I am gonna die in this place. But I said it in English, and the nurses overheard me. And I think all of a sudden they thought to themselves, oh my God, this is somebody from, the UK or America, whatever it is that they thought. So immediately they started making me a priority just because of that. Because they kind of realized, oh, this person will have money. That was the time they were finally able to get a doctor to see me. Right? Imagine I was there in pain all that time. I didn't say anything. I just happened to speak to the others that were there with me. I was like in English, we were all from the UK. And I was like, I was like, I would die in this place. I'm in so much pain. Can't we go anywhere else? And the nurses and they made me a priority straight away. They were able to take me to a room, everything, and they started treating me. First of all, I had to tell the doctor everything, literally step by step. I had to guide the doctor. I understand, as a patient, you know yourself better than any other person. Even in the UK, when I go to the hospital here, they will ask, okay, what is your treatment? I understand that. But with this one, I literally had to tell the doctor, the nurses, what to do. So literally, they were starting to prescribe a long list of medications that I don't take. I've never taken. That is not for sickle cell. So I literally had to explain to them step by step what they needed to do. So imagine if I was in such a critical condition where I could not speak. What would have happened then? And if I did not have of course, my family and friends there and all of that. What if I was in such a dire, critical situation where I couldn't speak and tell them what they needed to do? They seemed like they had no idea. And so while I was in this hospital at night, right? Light went off. I had slept off. So I woke up and it was dark. And guess what happened? I woke up, I was trying to look for a bell to call for help. A bell. First of all, there is no bell. And then I was like, okay, they don't have a call bell in this hospital. So I started going, doctor, please, can I speak to a doctor? They're like, madam, it is 9 o'clock. The doctor is no longer around. I'm like, what? The doctor is no longer around. Excuse me, what? And well, can I see another doctor? There is no doctor around. And I was like, hold on. Even the nurses at this time were not there. First of all, it's the patient that is telling me this. And I was like, okay, there's no doctors. That's fine. Nurse, where is the nurse? The nurses have left. To do what? It's night time. The nurses have left. The patients were in darkness. Lights don't go. And there are no doctors, no nurses around. I was like, my life is over. I mean, what am I going to do? It's so crazy to the point because I had my own medication. I had to self-medicate while I was in hospital. I was that the next day, I'm like, I am not spending one more night in this place. Upon all the money that they have charged for everything, including needles, everything. Upon all that money, there was nobody. So what if a situation had gotten critical? The worst thing, right? So remember in the beginning, I told you that during the time when I was getting admitted, when, I was in the queue waiting, there was a girl there, a little girl, who looked about maybe 6, 7 years of age or so, right? Whose who was also there and that had sickle cell. I was in the adult female section, right? So in the morning when my aunt slept there because there was no way they were, thank God she was even there because there's no doctor, there's no nurse, there's nobody. Thank God my aunts decided to stay there. They had to go and buy fresh pillows, blanket, everything for me because I could not even lie down on that bed. And I'm not trying to put down, it's just that common. We all have to change. The fact that I was going back to that same hospital, I was taken there while I was young and I was a child. I was taken to that same hospital and ended up having, as far as my memory, is the same thing. Nothing had changed. And this was like maybe 10 or more years later. And nothing had changed. Nothing. The worst thing was that I woke up that morning, right, to somebody screaming and crying outside. So I managed to get off the bed with the support of my auntie to see what was happening. Why was this? And I saw this woman screaming, rolling all over the floor. And I turned to my auntie. I was like, wasn't this the lady that when we were waiting in the queue that had the child? They said, yes, the little girl passed away that night. Why? Because she needed oxygen. And there was no electricity. So she didn't get the oxygen. A life wasted. After that, I was compelled to do something. It's not for me. I don't believe in just about complaining, but doing something. So that was one of the things that pushed me towards setting up my own foundation, because I wanted to be able to help other parents with sickle cell like myself. The fact that while we were waiting, we bonded with this family, even though I was in pain and all of that. My auntie was talking to those parents, they were explaining, and my auntie was saying, yeah, me too, me picking at the same thing again, at the same ill sickness, but encouraging the parents that, look, she's this age, she's made it this far, only for them to lose their child that night. I was so hurt by this. I was like, I am not spending one more night in this place. I don't care if I'm going to die, God forbid. Let it happen elsewhere. So that after that day, I ended up getting discharged and went back over to Lunge, where I had my own private doctor. It shouldn't be like that. Every life should be valuable and every life should be treated as being valuable regardless of financial status, regardless of gender, class, race, ethnicity, you name it. Regardless of that, every life is valuable and it should be treated as so. So I'm going to share my screen with you before my guest comes on, because I want us to look at this statistic, some of these figures that I've got here, to give you a better idea of what it is that I'm talking about, what people are going through, and so we can all think about this and think of how we can come in and help. Because it is easy to just blame other people. It's easy to blame the government. But before you do that, you need to think to yourself, what have I done to make a difference? Or what am I going to do to change this? You cannot save everybody's life. Yes, you can't. But just by helping one life, you are helping generations to come. Generations. Because of all these experiences, I was able to go on to set up my foundation, the Thora Foundation. And right now, I am glad to say that we have our center that is treating over 80 patients monthly for free. They get their monthly medications, they get checkup, blood test. We do that. And that is 80 different families that don't have to sell literally their stuff there and all of that. And yes, I know that does not mean I'm not the superhero coming to save everybody. I can't save everyone. And even with all of that, some people may still not be as fortunate. They may still succumb to the disease. But at least I'm doing something. At least I decided to take that initiative, not to rely on government, not to wait for government, not to wait for an NGO, because that is one of our big problems. We rely so much on others, on this white savior complex. Like we rely on them to come and be our saviors, and that is part of our problem, because we have to find a way to save ourselves. We have to find a way. Yes, you can say, I am just one person, what can I do? Well, guess what? If everybody says that, nothing will ever get done. Nothing. Thomas Edison was just one person, but he helped to discover electricity, which is now helping billions of people. Some things that you may do now, they may not even have an impact. You might never see the impact of that decision and what you are doing while you are alive, but it might be something that helps generations down the line. So don't ever sit down and think, well, I'm just one person, I can't do anything. No. If everybody sits and thinks that way, well, guess what? We will continue going through this. And that is just, what it is. We all have to somehow play a part and play our role. It does not matter how small that role is, it is significant. Your role may save lives more than you can even ever imagine. So never ever underestimate what one person can do. Never. And you may be that person. So if you can take anything from today, know that you are just as powerful. But we are even more powerful when we come together, which we'll be talking more about. But I'm going to share my screen with you because I want to show you some statistics, so you can have really a bigger picture of what it is that we're talking about and why this is so important. So I'm going to share my screen with you. Okay, 1 second. Just there. All right. So I've got here different statistics, right? And I'm sharing my screen with you. So I want you to take a look at this. This, and is also by country. This is the statistic for under 5 mortality rate. Mortality rates, right? This is per every 1,000 birth. Mortality rate talks about like the rate of those that die, as a result of whatever health issue, whatever. So this is, we don't know specifically the particular health issue or complication, but this is the rate of under 5s that are dying. And this is per 1,000 birth. And this statistic was done in 2017. And I want to come down and show you. See, these are all the different African countries, right? These are all the different African countries. This is the ones. Libya has the lowest. So if you see here, Libya, right? They have the lowest. And then we come to the highest. The highest is Somalia, then you have Chad, you have Central African Republic, and then guess who? Sierra Leone, right here. We have the fourth highest on the 5 mortality rate. Fourth highest. I want that to sink in. Think about that. Think about that. These are on the 5s, babies, kids. That these are lives that never get the chance to make it, even to 5 years of age. For so many reasons, of course, why they die, but we know health also plays a great role. But these are kids that never get an opportunity to grow up and become adults. These are kids that would never realize their dreams. Kids that would never know what it is like to be an adult. Kids that have dreams. Kids that could have been tomorrow's leaders. Kids that could have been the next president, the next leaders. These are kids that never get that chance. And then we come to other statistics, all right? All right, so this is like gynecologists, so obstetricians, qualified, right? This is the statistic for that. And gynecologists and obstetricians, always that word triggers me. They're very important because these are the ones we rely on to be able to deliver our babies, to be able to support pregnant women and all of that. That we're talking about those that are qualified. And look at the statistic for that. And yet again, Sierra Leone found ourselves in 3rd place for the lowest number of qualified ones. Can you imagine? It is really sad, but I like to talk and match my words, right? And this is the statistics, government health expenditure as percentage central health expenditure. So the percentage of expenditure that goes towards health specifically. And the highest, the country that puts the highest, you can see it here, right? These are all African countries. You can see it here, right? And then the one that spends the lowest towards health, the one that spends the lowest percentage of the total expenditure for the government towards health, guess who it is? Sierra Leone. I like to talk and make sure that I can back up what I say. And that's why I am somebody that I love statistics and that, because it shows clearly that I am not just making these things up. These are things, this is, you can go and find it yourself. Can you see the websites there? African Health Statistic. This is the density of health workers, physicians. And yet again, Sierra Leone, we find ourselves the 3rd highest. The 3rd lowest, We find ourselves the 3rd lowest for the number of physicians in a country. And it looks at it per 1,000. So I don't want anybody saying, oh, it is because of our population. No, it looks at it as per 10,000 population. So they're not looking at it. We know countries like Nigeria are heavily populated. And obviously, it would not be fair to compare them and us population-wise. So the statistics, when they do it, they make it fair by making sure it's a percentage of population, whether it's for for every 1,000 or every 10,000 or whatever per population. That's what they do to make it as fair as possible. So nobody can in turn complain. No. And this is the mortality rate from non-communicable diseases in Africa, right? And this is from WHO, Global Statistics for Women, Children, and Adolescents. So yes, so that is for 2016. And this is it. This is the mortality rate. And you can see here yet again, look at the country that has the highest mortality rate. And this is they do it per percentage. So again, Sierra Leone, we have the highest mortality rate, right, for non-communicable diseases, which our guest is going to go more into. And I'm about to have my guest, but before I bring on my special guest, and who is not just a health medical professional that's worked in Sierra Leone and now also in the UK, he is also an activist, somebody that's also for the people, which is what I focus on. I'm about to have him, that's Musa. But before we do that, we're going to go on a little break. So while we're going to break, you can leave your comments. We will be going through comments and all of that. So I'm very excited to be bringing on my guest. And so, we can talk about this from somebody who actually, understands this from a medical point of view. Because as I say, I am only a professional patient, not a health professional. So yeah, we're about to have him, but let's go on a quick break, and please don't go anywhere. This break is only a minute and we will be
I'm getting back up on my feet. That you showed up was written in the palm. You are a statement, explode like a bomb. I get to push myself to victory. You make me winner. You cut me loose and set me free. You make me win in every way. You show me how to spread my wings. Yes, I'm the winner of the day. You cut me loose and set me free. You make me win in every way. You show me how to spread my wings. Yes, I'm the winner of the day. Yes, I'm the winner.
okay, everybody. Welcome back. All righty. Welcome back. Hope you like that little break. Yes, it is me. Yes, I am a business coach and marketing strategist. So yeah, if you do need my support, you want help with your business, anything, marketing, I offer 30 minutes free consultation complimentary. And if you go on my website, which is miriamk.co.uk, you'll be able to book a session there with me. So yes, I'm excited now because we're having our guest come on, who is Mr. Musa Vibbie, who is a medical health professional, as I say, a nurse, and also an activist. And I'm excited to have him. So welcome, Musa. Welcome.
Yeah, Ona, good evening, good evening, good evening. Nice to be on this platform. I've been on the look up to this anyway, to be here.
You welcome. You more than welcome. Thank you for they are so, and I know you're a busy man, but you've taken time out of your precious day to be here, and I really appreciate that. So let's start. Tell us a bit about yourself and your just your journey thus far, whether it be with in terms of education and also job and all of that and other extracurricular activities.
Uh, Let me just make it short. As soon as I know my name, Namuso Vibbie, born in Sierra Leone, attended the ROC school, Daru, and because of the war affected us, I went to UBC school, Mobimo, and I went to um, St. Teresa primary school, race course, and my secondary school was Christ the King College. And after spending years, I came to St. Edward's, where I sat to my wives, and I went back to Jala University. I was the first batch when they uh, made the former paramedical as a medical school. Graduated uh, as a registered nurse in 2010, and I got my first job with Medicine Sans Frontières, Doctors Without Boundary, and worked there as a nurse for a certain period of time. And after that, I traveled to Asia, where I worked for several years, and I came to the Netherlands, where I previously left for the UK. To work and pursue my career because I'm also at the verge of trying to uh, finish my law degree. So it's a very simple. I'm a very simple man, life going man, and I believe in a very good health. You know, and I cherish friends and I cherish people, but sometimes when you cross me, life, I can also be crossed because actually an activist. So that is just me. Simple.
Exactly. But it is great. I like people who are passionate about, what the about others and wanting to see changes, and wanting to see improvement. So why did you decide to go into the health field? What compelled you? Because I know, as an African man, and I remember being young when I was in Africa. It's like nursing or whatever is for women. That kind of way people think of it. So, what compelled you, or what motivated you to go into the health field?
Um, when I took my WAS exam, I actually got my requirements, and most of my colleagues were telling me, Musa, you need to go at least uh, go do your doctorate degree. But my mom was motivating me, and my mom is also a nurse. So she told me, and the fact is, in the near future, Musa, I get for bring you come abroad. And the fact remains, if you're a medical doctor, you kaya, it get for take you years for let you convert that, you know, that you degree to the equivalent to the degree to the UK. So it get for take you period of time again, you get for restudy. So, but if you do nothing, and when you the fact that you reach here, what you need for do now, forget your PIN code. And you after you don't get your PIN code, you don't go do the practical exam and theory exam straight away, you did get a job. And the fact people be they say, man, just like what you say, man, the fact remain this now women's job. Well, that is the mentality of the people, but that isn't true because you can do nursing to a PhD level. You know, there are so many men in the UK. Like, even when you are a male nurse, You become so hot in the market, you know. So uh, I like the fact that I choose nursing because I know how much it don't help me into this day.
Yeah, definitely. And as you know, a professional patient, I can definitely testify that I've had some great male nurses, and and not an incredible field. And when I know they ever know really how important when are they to, like, some of we, there's some way literally they don't become more somewhat like a family to you, because you get to see these people sometimes and even spend more time with them, and then you get to with your family, especially when you get a chronic condition where you go in all the time. So what were your experiences as a healthcare, what are your experiences of the healthcare system in Sierra Leone or Africa, but I know mostly like Sierra Leone? What were your experiences?
Well, I have both positive and negative experience, the bad and the good one. In Sierra Leone, the medical system, uh, it need a lot of improvement. Like the period of time where maybe then as Sierra Leone, where I be the work as a nurse, I be the work both with the MSF and I be the work with government hospital. But let's focus on the government hospital because there lies the general hospital for the people of Sierra Leone. If you look the medical stages them in the Ministry of Health and Sanitation, they get cadres and those cadres from the above the minister himself, it gets in deputy, it gets the center medical team right inside the Ministry of Health and Sanitation, and then they go them put that it joined to the district hospitals and district workers to the PHUs, which are the peripheral healthcare units or centers. So let's say if like when they introduced the free healthcare in 2010, and in 2010 when the free healthcare system came, one of the reasons why it doesn't really became successful because it was dishonesty within the ministry and the healthcare system. Let's say the medicines that were coming in, or they normally they send from abroad for help the people then get access to it. Those medicines are not going to the peripheral healthcare units. Then let we say for example, um, the district, let's say like one district, let's take example like Kabbalah district or Kenima district, for example. When the medicine they left, uh, by the time the medicine they left Freetown, now the drugstore, it they come, they don't cut most of the medicine them, they don't thief them. And then medicine, and they, if you go all around Sierra Leone, you they see them at pharmacies, you they see them medicine in neighboring countries, and people they go sell the medicine the way it be say NGOs or non-governmental organizations that don't cater for send for the people of Sierra Leone. Then they take their medicine and they then sell their medicine and they now pharmacies and all the rest. So you they see say in the peripheral healthcare units them within the district level, like all these villages where they deal with more maternal, child, the mother and the child, you know, they realize they are deprived of getting their medicine because the reason is this medicine has been sold. So my experience was the reason why the free healthcare system doesn't work now, Sierra Leone, is due to corruption by them within the 2010 when it was really introduced. And in Sierra Leone, there have been a system where I believe, say, maybe the government will look into that system. We get cadres in the medical system. You know, those cadres, we get the nurses then where they call the state enrolled community health nurses, which is the SECHN. Those SECHN, they are actually trained to work in the community in those PHUs. So those SECHN, they need to run those PHUs and remove the CHOs, which are the community health officers, give them, upgrade their system to become doctors' assistants. In the whole world, we have what we call doctors' assistants, but Sierra Leone doesn't have it. The reason being, badats. Because the doctors, they don't want people the way they refer to them as doctors' assistants. You know, so the CHOs, they are not supposed to be in those villages. They are supposed to be at the district health center as helping those doctors, having more training in order to upgrade the healthcare system.
Sorry about that. Yeah, go on.
Yeah. So these are some of the experiences that we are really get now Sierra Leone, because like example, you try to talk, you're so passionate about sickle cell anemia, because this is something where they really affect you. And
Yeah.
most of the time, I don't watch you videos them, you interviews them, where you don't go to the extent for create an NGO where they help beginner, because you so much don't passionate. But people like you are people then where the society of Sierra Leone for actually cherish honor, because if you as an individual they come with such an initiative and try to help people in terms of treatment, in terms of this, is a very big concern you are showing to your country. You are paying back to your country instead of taking it. There are people who have the same opportunity like you have. They have been living in abroad, who are making money, but they have no concern to talk about that. And some of them even have sickle cell anemia, you know. And when you were talking about your experience as a small child, wherein you were having oxygen or this or that, these are truths. Because once you have the sickle cell anemia, definitely your red blood cells, they are kind of sticky, and they are not
Yes.
in the right shape. So they become like a moon-like shape. So this red blood cells or the hemoglobin, they don't allow oxygen into your cells or your organs. So you definitely experience a kind of pain within your joint. And sometimes you see you even get swelling in the lower extremities. And because of this, um, the low presence of this hemoglobin, you realize people with sickle cell anemia, they develop a lot of infection if you don't have the opportunity in order for you to take care of yourself and all the rest. You can do that because normally, like you live in the UK, the NHS is taking care of, you are paying your, for all of these, and the government is catering for you. So you realize that they even change your blood. in certain period of time in order for you to gain that presence of hemoglobin for your life to move on. But think
Yeah.
about those back in Africa, in a very poor country, you know, uh, living in the at the district levels, in the villages, who cannot afford that.
Yes. Yeah, exactly.
So what they definitely do sometimes is to have this what they call country medicine, then leave
Hmm.
them, then they even
Yeah,
do.
100%. Yeah, exactly.
Yeah. And some people then they associate that thinking and they to witchcraft.
Yeah,
So,
exactly.
you
I
know,
myself was branded that and I was told to confess. Imagine at the age
yeah,
of 6, I did not even know fully what witchcraft was. And here I was being told to confess. Confess to what? And I remember crying to my grandma and begging my grandma, I was like, please, is God punishing me because I'm a witch?
you said,
And no child should be in that place where they feel like that because I did not fully understand. I was brought up to worship God, and now I'm being branded a witch, and I need to confess. And I didn't know what am I confessing for. And sometimes they actually go to the point where a child feels pressured to. It's just that I had my family that was able to back me up and be there. But there are people that will feel compelled to just confess for nothing because they feel like, well, maybe if I confess, then people will leave me alone. It's not right, and that is what really compelled me to want to do something. And we are raising awareness. We go to schools, public places, giving out information, flyers, all of that. And we're also starting like outreach programs to go to the rural inner villages to get these people tested, their medication. And during the pandemic, during the lockdown and all of that going on, my team will personally make sure who cannot make it to the center to receive their medications for the month, they will take it to them because I know how important it is at that time to make sure they're getting their treatment because I know this. And also before even, right, I was fortunate to be in the UK where NHS sent me information about COVID well ahead of time. That same information, I created a booklet, flyers out of that information, and we got that out there way before even people were talking about it back home because I knew, this is coming and they need to be protected.
yeah,
Washing facilities to ensure that our patients are protected and spoke to them so they know how to protect themselves. And this is not something that even the government was doing. But now, my question to you is what do you think needs to happen to bring about changes? Whether it doesn't have to be just the government, even the people themselves. What do you think needs to happen?
um, oh, really, what needs to happen is, as I said earlier, corruption, uh, is something that has actually, uh, you know, captured the development in Sierra Leone, corruption. So if government have to deal with any aspect, they have to like try to fight corruption in Sierra Leone and try to finish it. Like presently, we have seen over the period of years, corruption has little bit lessened down as compared to before. And government should try to make sure that the Ministry of Health or the people that are dealing with the those medicines that people should have, which are sent from abroad to help people access them, they should make sure that those medicine reach to those people with an affordable price. Because if you can access it and afford for it, then you can have it. But to deal with the maternal mortality rate in Sierra Leone, I emphasize that government remove all the CHOs. Like if you can ask me, the CHOs, people know them, but maybe they are new to you because you live in the UK for very long years. Those people should be given they should add to their curriculum, educational curriculum, and make them doctors' assistant. Because Sierra Leone, we don't have much doctors. We don't have. And that is one of the issues. Sierra Leone has a population of 7.4 million people. And within those 7.4 million people, 1 million people live in the Western area. Where in the Western area have the most of the referral hospitals. And at the district level, we have few hospitals. So if someone lives in a very small village who is already sick, and that individual need oxygen, and the only oxygen that is available is in Freetown. So if that person is at the point of death, to take that individual to Freetown, by the time that individual reach Freetown, he don't die. That are most of the cases them where if you walk now Sierra Leone, you experience all of that. Like the time where be the walk now Kabbalah Government Hospital. One of the major thing, maybe I go share them, but I not go actually because I don't disclose medical issues of any individual by mentioning their name. It's a code of conduct we don't do in medicine. But I can briefly explain something will happen due to the fact that even the road system inside Salon is so poor. Now we didn't see improvement. There was a patient where the fetus die. You understand what I mean? Like the fetus die. And the fetus die, the people then say, we country people then they say maybe now something else, so they begin getting country medicine. So it take a period of 2 weeks. Imagine. So absolutely, you go realize there have been a great infection. So by the time that individual was brought up to Kabbalah Government Hospital, infection don't overtake the whole body. So except otherwise, there was an operation done. So if we need for improve the medical system inside Salon, government for make sure say the people then get their medicine, and they go able afford them. So that is it.
Wow. I think that's really great. But in terms of the government itself, what advice would you give to like the leaders regarding what they need to do to help with this? I know no one leader can make these changes. These are things that need to happen over years. But how can we get the ball rolling?
Well, first of all, to cut matter short, we all know, say, Sierra Leone become really, really they down as one of the poorest, one of the most corrupt, and all of that. This is not about this. We are discussing about health. We are not discussing about politics. But to be honest enough, that country now we leaders and we don't destroy the country. And not only we and them will make that country, every individual involved. You they play your own part. You are helping people out there. You they create Sierra Leone. You they build Sierra Leone. If another person self grab it, they help. So let we begin to help one another. We go build Sierra Leone. And for the government, whoever the government they appoint, Now, all of those offices, they especially within the Ministry of Health, because say, now this part of the world, NHS, now the whole country there. Yes. So if the government go to build that system there and try for make a corrupt free, take the individual where it fit for the another place there, then I believe say Sierra Leone go get a progress. It no go sound like during the days of Ebola, where Sierra Leone not ever prepared for nothing.
Yep.
There was, when Ebola burst out, there was nothing. Like now, waiting we they see how they attack the corona. Now that makes Salona suffer from casualty. So one of the other things where I will advise the government is to introduce some technology in the healthcare system at Salon, which we lack. Let us say all of these like oxygen and all the rest of that. Salon we not get. I don't know if you say we get more than 3 oxygen or 4 oxygen. Yeah, where it go really, where they say this oxygen go, a plant here go able to supply more than 10 to 15 patients. We don't have it. So we need to get more of that. That's the first thing. Then, secondly, let government introduce waiting and they use now the UK what they call Nourish. Nourish is just a phone. It's a common phone. You just download the apps. So the government for try for provide a strong Samsung phones right across the country, which is affordable.
Yes.
Put an internet in those hospitals and places. Download those Nourish. Because one of the reasons why I said so, most of the cases then where they die in their hospital is because of the lack of monitoring of vital signs. Most of the nurses, the doctors, and all healthcare workers, they don't monitor those patients. Maybe my colleagues will vex by me, but I could talk because the reason is, let we make Salon better. You they go do night shifts. You they go work na net. A patient they in a critical condition. And then the doctor tell you, say, Giam, hourly vital signs, checking vital signs, hourly, or every 30 minutes for no. Then you go take, because of only this is a sheet, is a booklet, 9-day salon. You take the pen, you not check that patient from 9 o'clock to 1 a.m. in the morning, but you just enter and write. Say, I don't check this, I don't check this. You self-set, they destroy Sierra Leone and you destroy the healthcare system. So if government creates this Nourish system, this telephone with this program downloaded, whatever you do on that patient, it register another Nourish. So if you not take the vital signs, you just go enter, it register. Because this is something where it gets how I will call it. It's a phone, but it get direct connection to the small tube where they fix on the wall. So you take the phone, you push on here, and there's information come up for the patient. So you get to put those information, because when the doctor come, it no more get for look into books, but they look into the phone. The diagnose and all the rest of that patient, they into that phone. So there is no way where you go miss, no for check the particular patient. So if they do those things, it will help.
Yeah, there'll be more accountability as well.
Yeah.
People will be able to focus, because just as I said earlier, I was in the hospital to wake up and there was no doctor, no nurse, no nothing, no electricity. And So, God forbid, had my condition gotten critical at that time, that would have been it. Just like the other patient, the other family who lost their child that night because of oxygen. And I'm sure nobody was around to even notice, because they have this thing, just as you say, they will just write. And so there's no accountability, and everybody is kind of like, because they're all doing the same thing, so everybody, whereas in the UK that doesn't happen. You do something, even if that person, you and them seem to be friends, they don't care, they're going to take note of it. My mom is a nurse. You take note of everything, they will report it. It's not about, oh, we're friends, I know you, I know. No, 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 because they know their pain are at risk. Their job is at risk. Their job is at risk. Their pain is at risk. So they make sure that they do what they need to do, and they will have to hold you accountable, because that is how you learn. But when there is no accountability, there will be no learning, and there will be no stability, and we'll just keep going like that. And that is so important to have. And thank you so much for that. It's just been great also learning from you, from a different perspective and point of view, from an actual professional, because my own experience, it stops at being a patient. I have the practical knowledge and awareness, but not the theoretical one. And so I wanted to ask, in terms of you now as a person, with everything that you're doing, what is your goal? What are your future plans? And I know how much you're passionate about things, and so what are your goals and your plans and things that you want to do?
Well, I never know what is going to happen tomorrow. Of course,
Yeah,
I know waiting to happen now. But if I happens for leave in the future, I
God's
go
grace.
I go look for join the government of Sierra Leone, whoever they rule by them. I don't, it's not deep, because development is not by I belong to this political party or this. It's about developing Sierra Leone as a whole.
Yes.
So whoever go there in a position, I go look for work with the government, especially in two areas. I did try to get more knowledge, because we know they done for land. A human being know they done for land. Why did steal the land for get more knowledge? And that is the health and the justice system. And those two areas need for be addressed strongly. The reason why the justice system is because we get for hold people accountable for doing all those things. Like, you thief medicine, where you well know say that medicine I get for men, those people, they need them. Then you want great thief, you go sell them just because you need for satisfy your own desire. At the end of the day, you thief that medicine, there you go sell them. You sit down at rumba, you get all the girlfriend them close to you, you they enjoy. Why is another man they suffer, another man they die? So those type of people, because they're so wicked, they need for facing the justice system. Lock them up, let them suffer. So when they suffered, when they come out, they go know say these things are not for do them again. And there is a parable now, Sierra Leone, where they say, kill dog before dog, let dog know say die day. So if you take somebody where you don't see something, you jail them, you get them like for 5 years, another man where you go see that thing, you know, go do them again. So the justice system need for coming in different areas, because we they compromise too much inside salon. Somebody they do this, it says they are connected to that person. So because of my connection, you can do nothing to me. It's all over the place now, salon. You understand? And it is real, because these have been a culture. It
It's
don't
all
be part
about
of
who
the
you know
culture.
and not what you know.
Yeah. So So let's try to stop all those things. I'm connected to this, I'm connected to that person, so I go against the law. No. So we try for blend these things together, make the justice system really strong inside Salon. You go see there will be so many changes. So I wish
Indeed.
for be a part
Indeed,
of that.
and you've got our support here,
So,
and I can't wait for the day we'll have you in whatever back in whatever capacity. I know with the will, the determination, and everything that you have, you will go far. And I truly, truly can't wait to see you at the top, because we need more people that have the people at heart and not just their own interest, their own personal interest, And we need a shake up, and a lot of this gray haired men, they need to retire and let a lot of young people come on board, because they'll bring fresh ideas, different perspective. And so you've got our support, definitely. But before we go, I wanted to ask, what are your 5 top tips or steps to success? With everything you've gone through, what would you, if you're giving somebody advice, what are the 5 top things that you would say, these are the tips, or these are the steps, or these are the things that have helped me?
the first thing I will ever say is hard work, and keep on walking, and never, never in this life give up. Forget about the criticism of people, because definitely it will come. The hate, the gallop on the way. Sometimes you move on, you try for climate step, you drop. Don't know the long day. Wake up again, stand up and keep on moving. Because at the end of the day, waiting matter on the journey. Now, whose side you arrive, not to whose side you come out. So that will be my advice to people towards success. Keep on working hard, keep on moving every day. Forget about everything that people will criticize you, people will say things about you, but just keep on walking, just keep on moving. Go get it. Be a go get it individual. Move on. Say, this I need them. These are my goals. I need this. Go there, work hard for it, and try forgetting. Because without working hard, definitely you will not achieve anything. That's absolutely, I will tell people that. It's not easy. Life will not be a bed of roses. Life is tough. Life itself is tough. So you have to be patient. Patience is another thing. So if I get to tell the 5 things and to people, that is what I will definitely tell them. Yeah.
Thank you so much. Those are great. I couldn't agree more with you, because people always talk about wanting to do things, but it's one thing to say I want to do something. It is another thing of making sure you keeping going, and you are always going to face challenges. That is life. If it's easy, everybody will be at the top, but you have to just be determined to keep going. And that is what I also live by, that regardless of challenges, struggles, you have to keep going. I know we were supposed to do this on a Saturday night, but obviously because somebody was not well, me, we couldn't do it then, because Saturdays, Friday or Sunday night is when we really have people here. I know a lot of people now are in bed because of, they have to go to work. So I'm going to have to find a day to bring you back on a Saturday or Friday, so we can actually have people come in and chime in. But today is a weekday, and a weekday is very difficult. But one person who is always here and never late, always here, is this beautiful woman, aka my mother. She said, "Hi, May." Anytime you see May, it's my mom. She's the only one that calls me that. And that does not give anybody right to call me May. That is my pet's name from my mom. May, you know, that's my pet name. But thank you so much, Mom. I know you're always here. Thanks for your support. I really always appreciate you. We appreciate all our moms. Thank you for being here. I'm going to let you go, but we have to organize again and come back on a weekend where we can have more people to come on in and give their thoughts, because it is 10 people have to go to work, and I know you two have to. And thank you so much for your understanding. I know we kept moving it because of me, but I really appreciate you coming, and it has been a really, you've enlightened me. I've learned a lot as well. So thank you so much for that. I'm going to let you go. And thank you so much, Musa. We have to definitely come back and do this again. So my mom still here. She said, well done to you both. Thank you so much, Mom. You're not, I know you staying up for this. You know, she is also, my mom is also actually a nurse. So this is also her passion, you know, and she's also helped me to have such great awareness, and she's helped to make me the woman I am today. So thank you so much, Mom. Thank you for that. I always appreciate your support. And Musa, I'm going to let you go. Thank you so much for being here. And we will do this again on a weekend and have people come in so we can have more of a conversation, you know. And yeah, Mom said an important topic indeed. So we'll have to come back and continue this conversation. But for today, here is where we're going to leave it, guys. Have a blessed night. Thank you so much, Musa. Have a blessed night, everybody. And I'm so glad you joined us. Or if you're watching this later, thank you. You can still comment even if you're watching it later on. So bye-bye, everyone. Bye-bye.